I'm Erin Moore. I'm a licensed professional clinical counselor at Ubuntu. And I work primarily with clients who have gone through trauma, depressive mood disorders, stuff like that. I don't really have any niche, so to speak. And I do work primarily with adults, and I am certified in EMDR, which is a trauma-informed counseling approach that helps to process trauma, anxiety, phobias, and the such. So that's it.
Cool.
Yeah.
So I'm Jason Cole. I'm a licensed professional counselor here at Ubuntu. And I focus primarily on younger clients, adolescents and young adults who are experiencing substance abuse issues or some sort of mental health disorder like anxiety, depression, that I can help them with. I use primarily CBT, DBT, which is cognitive behavioral therapy, and dialectic behavioral therapy to help improve mood and help people learn coping mechanisms.
So trauma is kind of multifaceted, right? So when we look at trauma, you know, in a general sense, it's any experience that causes a change in functioning, right, to your nervous system, right? So it kind of, I look at like schemas. So schemas are certain ways we feel about certain things, places, people, experiences, right? You go to church when you're a kid and you are in a Catholic mass and the priest gets up to do a homily and he's telling you you're going to go to hell. That is your schema of church as a kid, right? And you carry that with you. So with trauma, right, for instance, like somebody getting in a car accident, they might have an experience where they handle it just fine, right? They didn't notice anything. They were like, that was scary. And then they kind of move on with their lives. Someone else might have the same exact experience, and that every time they get in their car, they start to feel their heart race or their hands get clammy, and they they relive what happened to them during that time. So it's basically any adverse experience that you have that causes a change in the way that you adjust to the world, right? Or the way you view the world. That's how I see trauma overall. I mean, it's really, you could go on and on and on about trauma, right? The different types and how they might affect a certain person. But overall, it does change the way you view people, places, and things depending on what you experience. So,
Yeah, that's a really good definition. I haven't heard it put that way before, but it's very true. And the hardest thing about trauma, I think, is overcoming the preconceived notion that trauma is clear and defined.
yeah.
Because in most cases, things that you don't consider traumatic can be, and things that you would consider traumatic aren't. It's very uncertain. The only thing that is a core to it, which is what you said, is that it has to affect you personally. It has to be something that changes your outlook on life, the way you function, and your level of response to a stimulus, whatever it is that was related to the traumatic event.
Yeah,
so yeah,
absolutely.
It's hard to identify and hard to define, but most of the time, if you've experienced it, you know what it is. Well, so I can answer that from the clinical perspective, right?
Mm-hmm.
So when you are seeking help for addiction issues, the first thing that happens to you is you get an assessment. And when you get an assessment, the counselor who's talking to you is trying to find out the areas of your life that are affected by your use of alcohol or drugs. And almost all of the areas that they'll be looking at, the key component is negative consequences, significant life negative consequences. So that has to do with family, it has to do with friends, it has to do with police, job, it has to do with physical health, it has to do with mental preoccupation, all the characteristics of your life. If those things become negatively affected or you have negative consequences as a result of your substance use, then you're straying over in the area of addiction of one kind or another.
And to add to Jason and what you said, which was so well put, especially from a clinical perspective, is when you look at these behaviors and you really, write down what your priorities are. If you are addicted to anything, whether it's one thing, two things, right? You said alcohol, drugs, gambling, sex, food, right? If that is a priority, right? If that is the preoccupation and that's what you're going to, and you're abandoning your own needs, right? Your own basic needs, whether that be for yourself, your interpersonal affairs or your own affairs, then it's a pretty good indicator, right? And there's so many levels of it, right? If you have somebody in a family system who is completely supported, whether it's financially, emotionally, right, enabled, it's sometimes a lot harder for people to get to a place where they say, I may have a problem, right? So I really like the way you worded that with the assessment process, because it brought me back.
Yeah.
Yeah.
You're welcome.
Yeah, thank you.
Yeah, it is hard for somebody in denial in the first stages of addiction to see that their preoccupation is beyond normal.
Right.
Because to you, it does feel like it's the most important thing in the world,
Yep.
and you lose sight of the fact that it really shouldn't be.
Yeah.
Okay.
Yeah. When to start treating trauma and addiction when they coexist, right, is for me, it's the answer of it does depend. You have so many people coming in and they may have awareness of one or the other, right, but not both. Or that addiction is their only coping skill, and it's because the trauma they experienced has had that effect on them, right? And if they come in and they're not willing to get sober yet, or they're not willing to look at their trauma, right? In my opinion, and it may be an unpopular opinion, is you treat what they're willing to look at. And through that relationship that they develop with you, they may develop a level of comfort where they do start to want to, dig into some of the stuff, right? So like at Ubuntu, we have all these ancillary healing services, right? People might say, no, I'm good. Like that's like, I don't want to be touched. I don't want to get into that woo-woo stuff of Reiki or massage or, even yoga. And that's okay. And I think we talk about that a lot. But at the end of the day, if somebody is coming and is able to develop that therapeutic alliance with you, it is a start. And it may be a start that they've never had that opportunity to, or not the opportunity, but that eureka moment of, okay, I can be fully honest. And with addiction, one of the biggest things is dishonesty as a response, right? It's a trauma response, and the addiction itself puts you into a place where you're more likely to experience traumatic events, right? So it's just that place, that safe haven. So in my opinion, in a perfect world, right, you would want to start treating trauma once someone becomes sober. But the reality is that's not how people live, So.
No, and the reality is that a very large percentage of the people who come in for addiction counseling, I think it's upwards of 60 or 70%, have a co-occurring disorder of some kind.
Yeah.
And it could be anxiety, it could be depression, it could be many different things. Trauma is definitely one of them.
Well, sure.
And without doubt, it is more difficult to treat any one of those as a standalone problem. If somebody's got anxiety, there are, evidence-based practices to treat it. If somebody's got anxiety and alcoholism, oftentimes it's hard to pick which one you treat, how you treat them, in what order you do so. And it also, as you mentioned, most of the time, substance abuse is a coping mechanism for one of those mental health issues. And trauma is buried deeper than anxiety, but it's always part of the picture. And if it comes up during the course of addiction counseling, then I feel, like you said, it's the appropriate time to address it, because you meet them where they are. If they're not ready to talk about it, forcing the issue is probably not ideal. But we had, or I have had a lot of experience running and talking to people about trauma during addiction treatment. And the biggest thing for me is that it's important to remember to sort of close the door. So if you open it in order to work with a client, you can't let them, or it's unwise to let them walk off into the night unresolved or without some sort of closure related to the trauma. So if you open the door, it's important to go all the way in,
Yeah.
in my opinion.
Yeah. I like that. If like the trauma umbrella to me stands out, right? Like
Sure.
with trauma, like you might see PTSD, but you might, under that umbrella of trauma is the anxiety, is the depression, is the isolation, is all those, the negative self-talk, all these symptoms that we, see in our clients. And in a perfect world, again, yeah, dive in, like, but we have so little control over outcomes when it comes to it. So that's the one disheartening thing about going into trauma and addiction services, right?
Sure.
Is there's very little on our part without the willingness and the kind of, what's that, commitment to the process itself, which includes setbacks, includes, possibly includes relapses if that person does decide to get sober, and experiences times when trauma treatment can feel like you're really, really diving back into an open wound. So that safety is really important to create for a client.